that's what's brought me to be a part of this company, which is called Microba, where we are a microbial genomics company that has a technology for measuring the microorganisms that lives in and onside you. And there's a lot to unpack in that journey.
Yeah, so that's great, Luke. And so I guess really where I want to start is when you first started to talk to the researchers. Obviously, it does a certain function. You know, it can analyze and identify and describe the microorganisms in the microbiome in the gut, on the skin, better than anything else in the world. So it's a transformational sort of technology and understanding. What was the early conversations around in terms of trying to work out, well, what are we going to do with this? What were the sort of options? Because when we look at this, often we think, well, this could do lots of different things. This is a platform technology. It can solve lots of problems in lots of different ways. What were the sort of the headline options that maybe the researchers were thinking about, or maybe even you guys were thinking about when you first started having this conversation? And how did you go about trying to work out which ones of those looked more interesting than others?
Yeah, it was certainly not a simple task. To start with, what the researchers' view of the world is that they had a really robust solution to a problem, and the problem was that people wanted to understand about their microbiome. And now, when you actually dig into that a bit, people don't actually have a problem in wanting to understand their microbiome. The problem is much deeper, and so that actually was quite a journey to unpack. So I guess the first part of that journey was coming to a collective understanding that we don't actually yet have a solution to a problem. We've got an interesting technology, but we don't have a solution to a problem. And once we'd accepted that, then we can unpack what the potential options could be for solving real problems. One was the team thought we could develop a test that is able to determine deficiencies in someone's microbiome, and then build a suite of probiotics that is able to then deliver a solution to those individuals that have a deficient microbiome. So that was the first thing. We called that personalized probiotics. The second option was we could utilize the information within the microbiome to develop personalized dietary plans. So that was another option that we had on the table. Another one was that we could, with our information, do real diagnostics. So there's some real clear, interesting diagnostic signatures that we could pick out, and we could be a diagnostics company. Another option was, as I said before, we could identify therapeutic candidates based on the measurement tool that we had, and measuring patients that had particular diseases and understanding the microbiome's role in that disease. And another idea was that, again, going back to that, people want to know about their gut microbiome and how it impacts their health. There was a lot of consideration around a consumer testing business where we give people access to that information and the best of breed scientific literature that it's out there, so people can make decisions on their own health. So that was really, we had quite a challenge in front of us of all of those options.
And there was if I remember, there was a little bit of, I guess, because UQ is really strong in therapeutics and in the pharmaceuticals industry, having commercialized Gardasil and having a really strong therapeutic sort of pharmaceutical profile. There was a pretty strong sort of desire to explore that angle as this is a pharma play versus this quite opposite, which is a consumer, sort of general consumer healthcare. They seem like really big conflicting type opportunities, which have totally different, profoundly different business models. One's B2B, one might be B2C. How did that process go? Because ultimately, and maybe tell us which one you pursued, but how did you go through trying to evaluate those different opportunities?
Yeah, it was a really tricky challenge to solve, and what we had to weigh up was, with the capacity within the team, our ability to raise capital, and the appetite of investors, and the level of risk that existed within each of those opportunities. It wasn't really necessarily a decision on picking one, but it was around staging those opportunities. So where we decided that we had the nearest term opportunity to extract value from our technology was in delivering that testing to consumers. And by doing that we would have an opportunity to collect data from people that want to join a long-term research program, and that would then flow through to building the therapeutic opportunity. We didn't have the therapeutic opportunity until we had data. And so we either had to pay to get that data, or we could have a model whereby we deliver a service and we have that data basically build itself at a cost neutral level.
Yeah, okay. And one of the things we talk about is to try and validate or invalidate some of our assumptions. We look at a minimal viable product or some sort of version of this thing, which is not necessarily fully commercial. And that sounds a little bit like what you were doing, and what I know you did a trial at UQ where you did a test for 100 people or 200 people, and just talk to us about how that came about and how that was informing, or how that informed your understanding of, you know, the direction you're going to head in.
Yeah, and that's exactly, you're completely right. We had a number of assumptions there. We had a number of assumptions that one, that people would be interested in microbiome information about themselves to inform their diet, health, and lifestyle decisions. That we could capture meaningful data from those individuals, and that they would be willing to consent to share that data de-identified. And that we would then be able to mine that data to identify therapeutics leads. All assumptions. That we had reasonable basis for those assumptions, but they're assumptions. So if we started with that foundational step of the consumer testing and people wanting to access that information, that actually started with a very simple website. And it was a website with some low-cost ads, so banner ads on Google, to see how many people would hit that website and how many people would be interested in the potential of a testing service that would enable them to have that information on themselves. And we watched it. The research team watched that for a while and saw how many people would actually subscribe to a mailing list. There wasn't even a buy now. It was, we are looking to do this. And if you want to be kept up to date on when we may launch a product, put in your email here.
And where is this in the stage of company? Have we formed a company yet, or are we still in the research?
We hadn't formed a company yet at this stage. This was purely still at the research level.
Okay, cool.
But we were weighing up that commercial opportunity. The next step, as you said, was we were fortunate enough to get some funding to do an MVP of what that product could look like. And that was very basic. It was a bare bones MVP. We were able to then run a bit of a trial within the University of Queensland to see if we could collect the data that we believe that we could collect from individuals, and that people would actually fill out all of that information on their health to enable us to extract value, and that we could actually get some meaningful clinical insights starting to happen from that data, which would make us further validate that assumption that we can extract therapeutic assets out the other side. So that was the core next step, and that was successful. However, we didn't stop there and say, okay, well, we're ready to go. What we did is that we then used that information to say, well, we can now open up a pre-order campaign, because we hadn't gotten people to open their wallets yet. That is a critical barrier to jump over. You can offer people something for free, which is what we were doing in that UQ trial, and it enabled us to validate some assumptions, but it didn't enable us to validate the assumption that people would pay for that data. And we did that via launching a pre-order campaign off the back of an interesting ABC Catalyst series that the two founders were able to get involved in. And that really then showed us that we did have people that were willing to pay for that. They had handed over that money to us.
Yeah, and there's a few elements within that test, that experiment, even around the idea, without getting too much gruesome details. I mean, to actually use this service, you've actually got to perform some personal functions that might have been a hesitation or an assumption of whether people would do that or not.
Completely. Not everyone wants to take a poo test.
Yep.
Yeah.
and so that initial test actually validated that certain people, I guess not everyone, but certain people were actually prepared to do that.
They were. And then the next step was to validate that people would actually pay for that.
Yeah. Okay.
Yeah.
And I remember when the Catalyst program, which is an ABC television program that was featuring, the effect of human microbiome, of the effect of diet on changes in the microbiome, and the Microba team were doing the processing behind that. It was quite a successful ABC television program, and you were successful at getting the brand in there. And what was the feeling around going into that, having set up this wireframe sort of testing system and ordering system online? What was the feeling going into that program around how, in terms of that experiment, what were the hypothesis around how that might look, how that might work? What were the expectations like?
Oh, the expectations were pretty high, particularly from the founders and other people that were in the company at that early stage. That we were going to see this hockey stick of sales in that pre-order campaign. I would say it wasn't a hockey stick, but it was there was certainly a market there. But it definitely wasn't. It definitely wasn't the hockey stick that we thought it might be. So that's a reality check.
Yeah. Okay. And so we've jumped forward a little bit. I want to go back to the first capital raising, and what data did you have to have, or did you actually have, that was then sufficient enough to be able to get some serious investors to put some serious money? Because your first capital raising was quite significant.
Yeah. I think the basis for that is that we had demonstrated that interest in people wanting to access microbiome testing. So that interest that had trickled through on the website, plus the building market conditions, I would say, around gut health, were very strong indicators that there was an opportunity there for investors. There was a compelling case that we were able to make that there was a business there. The second aspect was that through the pilot project at UQ, we had really done the first step of validation that we were able to extract data that's set up for higher value opportunities, such as diagnostics, therapeutics, and probiotics. And given the market sizes of those opportunities, that the investors had confidence with the caliber of the team and the quality of the science, that they were real potential opportunities and that they were willing to take the risk.
So was there ever a time when the thought was that this could be a going concern just by providing this test, analysing the data and providing the data back to the consumer? Or was it always predicated on the fact that that was a means to an end, and the end in itself is what you could learn from that data and then monetize that insight from mining the data?
I think it was always viewed as a means to an end, not an end in itself. I think there was some speculation and thought that if delivered in the right way, it could be a little bit more than just a short means to an end, and it could be a really substantial revenue opportunity, but not as big as those longer term value added opportunity of therapeutics and diagnostics. Because I think that's really what attracted investors.
At some point, I'm sure you would have been looking at what happened with the 23andMe example. DNA testing has got a lot of similarities to what you guys are doing.
Yes.
And they went out, I guess the first part of their business model was just doing lots of DNA testing and providing information back to consumers. Now, did you look at that model as an analog of what you guys were doing and sort of take any insight from that?
Absolutely. I think that was one of the key references for investors, really. They had demonstrated that there was an opportunity in consumer testing although it was in host genomics, and that there was then future revenue opportunities from doing therapeutic deals from the data that's generated. It's absolutely the model that we used as a core reference. So there was a good deal precedent there.
And tell us a little bit about what 23andMe were able to do.
So they were able to sell a consumer test to millions of people. I mean, they did a fantastic job. And in a similar fashion, give people the opportunity to donate their data de-identified to a larger health cause to understand the impact of people's genomics on health and disease. And then they're able to transact with GSK with a really significant sum to develop therapeutics together. So that was a really core example that we could do a very similar thing, but with the gut microbiome, which has an equal, if not greater, impact on an individual's health.
Yeah. So you've got into a company, you've raised a reasonable amount of money to start up. You've got into some testing. How did you sort of then work out where was the goal? Like, how did you work out, again, product market fit? You could have gone down the probiotics, you could have gone down therapeutics, you could have gone down giving people advice about what food they should eat. What happened? What data point came in to actually make you go down one pathway or another?
Yeah, it's something that's not solved, I would say, at Microba. I think we continue to solve it in pieces. That's why I think it's a continual journey. So the first step was really to engage very, very, very heavily with our customers to develop the product. So we'd essentially taken money before we had built the product. And then we were really unpacking what the customer was looking for. So what are their problems? What information do they want to receive? And how do they want to receive that information? That was a huge amount of work that led to the development of our consumer product. On the other side, so moving ahead from the consumer product, we really had to go out and understand what those other parts of the business could look like. So if we were going to do a therapeutic deal, is it a deal like 23andMe did with GSK? And can we reasonably do a deal like that? So we really had to go out again and talk to customers. The customers were pharma companies, where we started engagements very early to say, if we have this type of data, or if we have this type of package of intellectual property, what is that worth to you, and would you transact? We had to do a similar thing in diagnostics to understand what that would look like and what a real solution to their problems would look like. So it was a lot of deep market analysis and validation with customers.
Yeah, and correct me if I'm wrong, but you've sort of even still got, I think, 3 elements. There may be more, but where you still offer a B2C play where consumers can do a test. You send them out a kit, they pay you, and they send you a sample, you send them the results, and you give them some advice. Maybe you could talk a little bit about that. But you've also got a strategy around working with healthcare providers. So not GPs, but also the other people that are in that healthcare system. And then you've also worked with researchers as well. So you've actually been, in some senses, exploring a few different business models in parallel. Just talk to us a little bit about that.
Yeah, so I guess what you've articulated there, Cameron, is we didn't have all the answers at day one, and I think most companies don't. We have some assumptions. We had a start for where we were going to get our initial revenues, but we had to really validate our assumptions for the other opportunities that we might pursue, work out how big they are, and work out how we would get there. So what we did is we stacked the business in a way where we had different business units, very strategically, that had a clear directive of going out and understanding what those business opportunities look like. So we had consumer, we had healthcare, which was essentially the testing to practitioners. We had research, which was we had a range of different potential customers that just wanted to access our analysis capability. It was either universities performing research, or it was companies that want to understand the effect of their products on the microbiome, or that are looking to develop drugs. So there were drug companies that just wanted to access our analytics capability. And then there was that longer term play of drug development, which we called ventures. So we structured the business with key objectives to go out and understand what those opportunities look like. And what we very quickly worked out is that the consumer side of the business, there's a limit to how many people are willing to pay for that information. We very quickly heard from the healthcare practitioner market that a certain segment of that market was hungry for that information, but other practitioner types were not. So, for example, we found that the early adopters were integrative practitioners that thought in a certain way about healthcare. So they're your naturopaths, your dietitians, your integrative general practitioners that think in a certain way, and that the other practitioner types actually will not utilize this type of technology until it's a point and shoot diagnostic with a drug that they can prescribe. The research part of the business was able to kick off straight away and sell basically our analysis capability, which generated revenue and continues to. So to be a successful company, it's fantastic to have big long-term goals, but you have to generate revenue or raise capital to get to those goals. So that was a nice part of the business where we're able to just sell what we've got at the moment to generate revenues to get us to our longer term goals. And then the ventures part, where we were looking at drug discovery, we really had to start mining the data that we had received from consenting individuals and see if we had some meaningful drug candidates. So we had a specific budget that we were going to put towards that and see if we could actually get some success and validate our assumptions and engage with the market to work out at what point would they actually do a deal. At what point would a drug company pay us $500 million for the asset that we were developing?
Okay. And so this consumer piece you've done, I mean, last we talked, it was over 5,000 tests, but it sounds like it's unlikely to be hundreds of thousands or millions of tests, because that consumer who wants that information, probably more the worried someone who's a bit affluent, and the doctors, again, there's a very small subset who are interested in the information, but the majority of the profession, that what we call the early majority, or even the early and late majority, they don't want to have really the information. They just want the information so they can actually prescribe a drug. So they can actually, that's fair. And is that fair?
They want it black and white, Cameron. Yeah. They want it black and white. Do they have a disease or do they not? And if they have the disease, what drug do I give them?
Okay. So that's not really, at least where you're at the moment, that's not a solution you can offer. It may be in the future, but not right now.
It's a research part of our business at the moment. Yeah.
Yeah. And then the researchers, again, they had a problem that you could solve because they needed data. They wanted to run experiments and they needed some ability to be able to analyze data or create data. And then so then they can analyze it. And that was a cash flow sort of generation exercise, and maybe identified some other opportunities as well.
Correct. With the consumer side, it's interesting because, again, if you go back to the 23andMe scenario, they did demonstrate that they can sell millions of tests. And what we really worked out is that there's a price point with a consumer that you unlock that discretionary spend. And it's not a price point that we are at to get to that mass market. And so, yeah, there is that opportunity to sell to millions, but it's at a certain price point which is not in the near term. So when we think about product market fit, it is product and it is market, but there's actually a third dimension. It's the product at the right price.
Yeah.
And that was a really key learning in terms of the consumer business. And to be, I guess, one of the learnings that we've had to go through is, do we want to compete in that business in a very undifferentiated market when a consumer only really considers price as being the most important thing? So there's other technologies that can deliver a, say, gut microbiome result to people that are a fraction of the cost. Now, they are nowhere near as good as what we can deliver, right? But a consumer doesn't appreciate that. And the actual cost to market that to someone and explain to them the difference and the additional value that they unlock for the higher price point is actually not worth, it's not worth it.
And so you've been sort of pivoting all the way along, running experiments, having lots of different sort of shots on goal, and sort of doing bits and pieces, but largely recognizing that there are limitations to certain of these verticals that you're chasing. And so just take us through, as we sort of, I don't want to take up too much more of your time, but take us through where you're sitting now in terms of where the long-term goal is for Microba, and what are some of the exciting opportunities that you can see that are going to lead to Microba being a successful player or game changer, I guess, in the public health space.
Yeah, it's a really important question, and it's one that we've been working a lot on. I would say what we've done through that initial stacking of the business is we've explored a lot of market opportunities. And really where we're at now is we're starting to draw a line through some of those opportunities. And really focus the business down on where we think the biggest ones exist, that we can execute on, and that we can be the best in the world at. And where we think that exists is in diagnostics. So we have now actually progressed from providing consumer microbiome information to consumers that are interested in that information on their health. We've progressed to now actually demonstrating that we can diagnose real diseases, and also predict the ability of individuals to respond to drugs, very expensive drugs. And there's some really, really big pain points there in making sure that the right patient gets the right drug. And so they're very high value opportunities. So diagnostics is a very clear future for Microba. The other side is that we've now actually tangibly demonstrated that we can identify therapeutic leads from our data set, which we have on 10,000 individuals now. And that those opportunities look real as potential drug candidates. And they are really significant opportunities. So the future for Microba, I think, exists very heavily in that diagnostics and therapeutic space, from what we've learned from the market. And so we're now really refining our focus to execute on them very intentionally.
Yeah, no, that's great. And what I love about this is the data collection which came from the consumer play. I mean, from what we've talked about before, that's profoundly, fundamentally got you to this point, even though that is not the business model necessarily you're based your future on, or your value is based on, but you've become a data company effectively. You've generated all this data. That's very special data, and now you're mining that data. Because what we know in the future is that the data is if you don't have data in part of your business model, you're probably going to be stuffed. And so it sounds interesting that you're able to generate that data in a sustainable way, in a cost-effective way. But the data creation now is not the focus. The focus is mining that data and working out how you can extract a leverage point, a 10 times value, or maybe even 100 times value from that data.
Exactly. And an interesting thing that we've demonstrated as well. First, to kick off and demonstrate that we can sell to consumers, and we can sell what we have at the moment to healthcare practitioners to generate that data. We had to go and do that ourselves. But through demonstrating that, we've actually then determined that there's existing companies that already have those customers in hand, and they are far better placed to do that at scale than us. They already have existing sales forces. They have existing marketing engines that are accessing those types of practitioners, for example. And so we've started to execute those types of deals. So rather than having to have a large sales and marketing team to attract those customers and then manage those customers and having customer service and all of those things that come with it, that we can actually license our technology to those companies, and they can do that, and we can still derive some revenue from that, and we can actually still derive data from that